All right, let's talk about alcohol. So, in adolescence, about 21% of patients under the age of 21 will use alcohol at some point. About 3% of these people will end up driving at some point. Most commonly, we use alcohol to fit in when we're at parties, we're hanging out, whatever it is. But some people start to use alcohol in order to fight depression or to fight against things that were traumatic, PTSD that they've experienced. The issue with alcohol is not necessarily that you're drinking, but what comes with drinking. So, vomiting and the bad hangovers that you feel the next day are sort of the more mild consequences. But some of the more extreme things are blacking out, that period of time where you forget things. It causes short term memory loss. And in that time, you might do things you don't want to do and you won't remember doing them. It can also cause long term memory loss. It can also cause problems with your liver and your pancreas. And over time, this can lead to other signs that may mean you need to seek medical attention, such as vomiting of blood, yellowing of your eyes. Those are signs that you have problems with your liver and your intestines. You might end up having abdominal pain that just won't go away, and you'll be unable to eat because of the nausea and the vomiting. And again, those are signs that there's something wrong, most likely with your pancreas, but also with your intestines. And while we know everybody's going to be drinking, some of the best ways to prevent problems while you're drinking are to alternate with water or to make sure you drink a lot of water at the end of the night or before you go out. Always eat before you go out. It helps absorb the alcohol and will make you feel better the next day. So always eat and then never ever drink and drive. Always have a DD. It's 2021 now, and we have Uber, we have Lyft, we have all these options for transportation. You should never be drinking and driving. And if you feel like you're getting to the point where you're either drinking every day or drinking so much every time you go out, or you can't go a day without drinking, or you wake up thinking about alcohol, then maybe it's time to stop. And you can always talk to your provider about these things. You can talk to your friends, you can talk to your family. And then when you leave the hospital, we can also give you information that will help you find people outside of the hospital to continue helping you to stop drinking.